Everybody, and a very warm welcome to the second version of Science in the City here held in South Africa. It's great to see so many people here tonight, and just really a very brief background to what this event is about. It's something that started in Trieste several years ago at ICGB. And it's an outreach event that is really intended to bring science and hot topics in science to the general public. And I think, today's topic, which is about IP and seeing how the fruits of modern molecular biology and biotechnology can really make a difference and reach people in countries that have low resources or really cannot afford expensive medicines. I think this is incredibly important, and there's many important issues that we need to discuss to ensure that such technologies become available for everybody. And I'm also really delighted that this is the second version of the event. In South Africa, we had the first one in Cape Town earlier in the year, and in this particular occasion, we're really delighted to be partnering with BioAfrica Convention in hosting this event. These are really brilliant guys to work with, and the BioAfrica Convention is something that for ICGB is an amazing event, and we're really looking forward to the next 2 to 3 days. So thank you again. And with that, I'll hand over to our moderator for this evening, Dr. Msomi. Thank you.
Good evening. Since this is our house, we get the privilege of introducing people. The person who's just opened the session for us is Dr. Lawrence Banks, who is the Director General of the International Center for Genetic Engineering and Biotechnology located in Trieste. He didn't introduce himself. I was explaining to you earlier that we put down 5 p.m. for the start of this event, but this is Durban. So we have a tradition of 5 for 6, meaning that we're starting at 6, but those who come at 5 get rewarded with more drinks than the ones who come at 6. So the ones that came at 6 are not going to have the drinks until we're done with the formalities. Before I continue on my rambling, I just want to introduce my esteemed panelists. On my immediate left is Dr. Dinaka Salunke, who is from the ICGB India. He's currently the director of ICGB India, and we will explain later what the ICGB is. Again, that's another omission from our Director General, because he assumed that we all know what ICGB is. So ICGB has 3 components. The main one in Trieste in Italy, and the other one, the second one in India. You could say the 2 main ones are in Italy and India, and we have the youngest, which is in Cape Town, South Africa, for the African continent. So Dinaka is the current director of the Indian component. He's one of our panelists. And next to him is Dr. McLean Sibanda. Did I get that right? Okay, McLean Sibanda. And he's a patent attorney with a very strong track record in innovation, having been a founder of several innovation institutes in this country, and one of the key architects of a law that I will rip into pieces later. I'm just warning him, the NIPMO Act. But he's one of our luminaries when it comes to understanding innovation and how the legal framework needs to work to support innovation. And on the far left is an old friend, one of our collaborators from Emory University, Stephen Sansa. He's the general counsel of Emory University. And again, those who are not familiar with Emory, Emory is one of the the top institutions in the world that works on antiretrovirals, on developing antiretrovirals. And being in this part of the world, in this continent, and having the burden of HIV that we have, antiretrovirals are incredibly important to us. And Emory has produced quite a significant number of these antiretrovirals, the backbone of treatment that we currently have, that has saved millions, tens of millions of lives. I know they don't like me bragging about it, but it's me who is bragging because I know them personally. It's not them that I'm bragging about, you know. So these are the esteemed panelists, and they will be looking at the topic of the day to try and understand how patenting, how intellectual property strategies can be leveraged for development. For a very long time, we've always used the IP issues as political footballs instead of thinking of smarter ways of leveraging the IP laws and all of that, because there's a rationale behind having to protect intellectual property. And ICGP is a very good place to have a conversation about this, because it was founded on the principles of ensuring that the whole world, particularly the developing world, the poor, marginalized societies, have access to the benefits of science. That was the founding principles of the ICGP. And BioAfrica, as you all know, is founded on the principles of enabling Africa as a continent to have access to these innovations and figuring out how to do that without messing up the system of innovation and smart partnering and alliances that make sense for everybody, what one would call a win-win partnership. But I don't want to spoil your fun today. I'm going to hand over to my panelists, and they will give their own perspective. And as part of this conversation, interaction, you are allowed to, at the time, to ask questions, either directly to the panelists, but you can't ask one question more than once. That's a rule, you know. It's not court. We're not trying to trap people. But yeah, and there will be people with a roving microphone to pass that. And for those who are viewing from the virtual platforms, they can send the questions to the chat box, and those questions would then be channeled to myself, and I would ask the panelists. But don't ask me questions. I don't know much about IP. These are the guys who are experts. Without further ado, I'd like to invite Tinaka to give us his perspective.
Thank you, Dr. Somi, and I'm glad to see we have on the panel three of us. Only one of them is a scientist, which is me, and other two are the lawyers. So I'm definitely not going to go into the legal issues of the intellectual property, but I can tell you how intellectual property can be generated, and I will let them fight out what is the best way to actually protect it. So as you know, I come from ICGB. ICGB was established about 33 years ago. First started in New Delhi and Trieste almost simultaneously, and Cape Town came much later, as Dr. Somi indicated. And ICGB's mandate was essentially to bring the fruits of technology development through biology to the people in the developing world. And most of the developing world, about 67 countries, are our members. And they have contributed immensely to what we do today. And ICGB has stood with its mandate in variety of areas, but focus of what we are going to discuss here is with regard to research. We concentrate on 3 domains, the industrial biotechnology, agriculture, health sciences, and also we are developing bioenergy methodologies. We have actually been able to take many of the technologies that have been developed to the people. Many diagnostic kits that have been developed in ICJB are in the market. One of them for dengue is actually distributed across the world. It is one of the major products for diagnostics of dengue in the world. And we have been developing vaccines which have been transferred to the industry for clinical development. So we have been actually standing by the mandate which we had, that is actually to help people in the member countries to get benefits of biology research. One of the reasons why the government of India invited ICGB to be established in New Delhi is essentially because what is mandate of ICGB seems to coincide with what government of India decided for its national development in terms of what are the most critical components for country to be developed as a leading developed country. The mission that was taken up right since the independence, irrespective of which government came, is actually to establish among the people of India scientific temper, and science is actually the purpose for the nation building was recognized right earnestly by all governments that have run the country for about 75 years, and actually it has borne fruits. If you think about Indian science, and ask question, what's the use of investing in science in India when there have been no Nobel Prizes except one that was also in the time it was not a independent nation. So investment that is made in India has never led to fruit is what somebody says, because we have not actually created giants who have actually won Nobel Prizes. But that is not what the mission was, and it was very well recognized by the Indian community that what we really need science for is for the country's development. It is to make sufficient food for poor people in India, develop medical facilities such that actually the mortality at the birth of children actually is reduced substantially. And if you look at in terms of those criteria, we have done phenomenally well. You look at green revolution that came in 60s, white revolution thereafter, and you can see information technology revolution that actually transformed India in terms of providing jobs to the middle class young students, which we have actually led the entire information service technology to be led from India. And right now we have been actually leading into even biotechnology. So the reasons for which investments were made in India for biotechnology have really borne fruits, and that was actually quite evident during the COVID pandemic in recent times. These investments have actually been distributed not only in terms of certain upper class families, but actually have been percolated all through. You can look at variety of these areas. I'm not going to concentrate on other parts like information technology or electronics or manufacturing. I'll concentrate only in biotechnology, and you can see two of the examples that I'll give you. One is in terms of drug industry or pharma industry. You can see majority of generic drugs actually are made in India. Generic because they are not covered in the patents and you can actually fully develop. The early education in chemistry and biology in India was remarkable, and it distributed across the country, and we have large number of very qualified scientists working in chemistry came out. and they were able to learn how to reverse engineer and develop new medicines which have just come out of the patent, and almost entire world, rather 60% of the generic medicines that are distributed in the world are actually developed in India. Similarly, the vaccine manufacturing, there are some of the largest manufacturing units for vaccines are India. Not only simply manufacturing, but development. In fact, during the time of the COVID, you can see the indigenously developed vaccine using actually samples from Indian patients have been turned into for the benefit of Indian people. So in other words, what I want to say is not only the technology development for manufacture of vaccines, but also actually starting from scratch, developing the vaccines has been proven to be extraordinarily useful in the pandemic. But before that, we have been actually leading manufacturers of vaccines for a variety of diseases. I will actually not go into the details. So in order to sum up, what I want to say is India has been rich in terms of developing technologies and actually making it for the benefit of the people, not only within the India, but for the rest of the world also. And that actually is what science has done, that actually has understanding and developing for a right purpose for the people, not only in India, but rest of the world, has been achieved by the policies that actually were implemented in India for science and technology. Thank you for your attention.
Thank you, Dinaka. So I had a discussion with a friend outside. Her name shall remain only known to myself. She said, Shubi, if you're nervous, wait for the first speaker. She'll prompt you, or he will prompt you to ask the second speaker a question on how to proceed. And Dinaka has just helped me in that way. I think he's very eloquently explained or described how India has made advances in innovation and in manufacturing and being a 60% producer of the global supply of generics and vaccines. Now I'm going to ask our second speaker, because he represents this continent, at least I think he does, that having heard what Dinaka was saying around what India has done in building an ecosystem, particularly the skills for reverse engineering, and if I had him right, without really infringing patents, with focusing on the skills, how do you think a continent like ours, in a country like South Africa, should proceed in trying to develop the depth required to satisfy the social objectives of universal access to health and security, food security? Not from a legal perspective, because he's already said lawyers are liars. So,
good evening. Thank you very much, Dinaka, for the introduction. So perhaps let me start off from I think from where Dinaka also left off in terms of, I think the significant investment in research and development is quite critical in order to be able to develop whether it's therapeutics or diagnostics, and in essence giving access to health. And we've seen huge investment going into India. Now, when it comes to the rest of the continent, here the continent being Africa, there is still a lot that is required in terms of investment in research and development. The heads of states have aspired to 1% of GDP. GDP is a moving target as the countries in the continent continue to develop, but none of them have actually reached 1%. We also know that the more investment in research and development a country does, the more likelihood that it will then have more patents there is a very close correlation between R&D investment and patent output. And as a result of the low investment in research and development, what we're seeing is also a very low output in terms of patents. Now, quite often the debate is why worry about patents, and so here a shift to wear perhaps a legal hat and say patents are quite important because in a way they're a proxy for development. They've been a proxy for development in many countries. And we know that the more patents there are, the more likely that some of those patents will be commercialized and end up in being innovations out there in the marketplace. But now, I think one of the things that Dinaka also spoke about is actually utilizing, if I heard him right, some of the patents that have lapsed. So the basis of a patent system is that one needs to disclose the invention, and in return, the governments actually then provide the protection or the monopoly. And that monopoly is for 20 years, subject to one paying legal fees. And if one continues to pay legal fees, you got protection in essence. And I think it's also quite critical to understand that you do not need a patent in order to be able to commercialize your own innovation. However, a patent is a negative right to keep other people away. Coming to the question in terms of how do then African countries perhaps start to utilize the patent system for development and perhaps start to follow up on the footsteps of India, is that given that patents have got a lifetime, which is 20 years, but also given the fact that it's the governments that grant the protection, we then get to the concept of territoriality, where certain patents or certain innovations are protected elsewhere, but they're not protected in a number of African countries. And also certain patents lapse because they get challenged and therefore they're found to be invalid. And when they are challenged, in essence, they then fall into the public domain. So I would perhaps submit two mechanisms in which we can make use of the patent system. The one is in respect of patents in the public domain. And so patents in the public domain will be patents that are protected elsewhere, or innovations that are protected elsewhere but not in the countries of interest, or they were protected but the patents have since lapsed. So the 20 years have gone, or they've been challenged elsewhere, therefore they're not valid. In that particular case, those innovations are in essence open for exploitation. So that is one mechanism, but it does mean or does require that we have to then build depth in respect of analyzing patent literature and patent data. In the same way that as a researcher, what one would do is do a literature search. It's quite important to then do a patent search. Literature, first of all, to be able to figure out which is relevant patents, and then secondly, are those patents valid and enforced in the country of interest? If not, then one then goes into the particular patent document and understands the subject matter, and the patent document is written in such a way that one is then able to reproduce. So that's one particular tactic. The second one is technology transfer. And in the case of technology transfer, one would assume in this particular case that the patents, the innovations are protected by patents which are valid and enforced, let's say in South Africa or in Kenya. In that particular respect, one then enters into a negotiation with the owner of the patents to access the patents and the know-how. And in that way, we then start to then build a capability. But both strategies, in essence, do require one to understand that patents are a critical source of technical information, but also, secondly, one to be able to access the specific databases, of patents, and then I think the last point is also to understand that not everything is in the patent document. So there's actually know-how, and in the case of know-how, the strategy to rely on is in essence, technology transfer as opposed to public domain. So let me stop here, and then we can be able to pick up during the Q&A. Thank you.
Thank you. Thank you, McLean. I'm trying to imagine what Stephen is feeling now. He's from the US. I had an interesting conversation this morning. So I'm not demonizing you. You are still my friend. We had an interesting conversation, not with Stephen, but with somebody, about how patents allow the inflows of capital, which is the lifeblood of some of the most important product innovation and discovery science, that you would not be able to attract and mobilize private capital of certain sorts if you did not have patents, because in reality what a patent is an asset class. And but that is a US model. And what I'm really intrigued or interested in hearing from Stephen, coming from an institution that has consistently created new models of how technology or how intellectual property could be structured to serve the interest of the wider world beyond the borders of the US. Maybe just a word or two on that.
Thank you, and thank you for having me. And I don't know that all lawyers are liars, but so I'm Emory's general counsel, and a lot of companies have general counsel. And that means you don't ask us anything specific, and so I'm going to speak to the generalities of this. And what I'd like to do, so I come from the U.S., I come from a university in the United States, and that brings with it we believe that's a certain role in the life sciences industry that's been very important, and that universities will continue to be important. And it gets directly, I think, Dr. Nsoma, to your question. And I'd like to go back in time just a little. If you go back 30 years, 20 years, when Emory's faculty had their first success with Mtriva, which is part of Truvada, part of Atripla. Those scientists achieved those objectives in spite of the university's tech transfer system, not because of it. Because the universities historically have been set up to promote and incentivize discovery. So the ideal is the scientist who has this eureka moment at a lab, and that's the discovery. And the discovery may or may not lead to what we call patents. But that's just the very first step in the process. And what I think we're recognizing in the United States, and I'm in conversations in South Africa, recognizing that even with a university, it's not enough. It's almost a dereliction of duty to simply stop at the discovery phase. You've got to go forward into the development phase. An advantage that we have as a community, I think, that those who fund development, and it's not just the private capital, it's not just private capital anymore, want to see universities and research institutes develop their patented products for public beneficial use. And let me expand that. I mean, the sort of sinister way to put it is university gets a patent and then licenses it to a company and that then tries to just extract money out of it. And without any question, that is part of the process. And anybody in any tech transfer office will tell you that without a patented technology, you're not going to have interest in the subsequent investment and development. But what we're finding now is that the other stakeholders care about it just as much. And I'm talking about two in particular, philanthropy and government funding. So Gates is famous for this. Gates wants to invest in patentable, commercializable technology. The United States government, particularly post-COVID, wants to invest in antivirals that have the potential for commercialization. that has two consequences. One of them, from my perspective, it is reinforcing the need, at least in the United States, for patent-protected technology, because our philanthropy supporters and our government supporters want to make sure that some commercial entity is going to pick it up and run with it. So point one, which depending on how you view it may be a negative, the patent becomes even more important to get this financial support. The other part is those stakeholders want to see the health benefit of the commercialization. So they're investing in a different way. What we're seeing is government funding that's interested in whether we have an opportunity for Rift Valley fever, not just hepatitis. Now, no criticism of supporting hepatitis, but that has a commercial market. But increasingly, you mentioned dengue. There is financial support for dengue, for Rift Valley fever, for other diseases that don't have the same commercial market. But those investors, philanthropic investors, social investors, still want to see patent protection on the technology, because they, I think, at the end believe that at some point in time there'll be a commercial partner for it. So perhaps it's ironic, paradoxical, but we're seeing greater support for social directed work, but it's also increasing the need for patent protection for our early stage technologies. Thank you.
I'm going to be requesting questions from the floor in 5 minutes. I'm just going to have one round of questions to my panel, prompted again on the advice of my colleague who was advising me outside to pick from the last speaker and then pivot the questions. I think what Stephen has just said triggered a question, and it's been raised slightly by Dinaka earlier. So I'm going to go back to Dinaka, because in essence, what are patents? When we speak about patents, we're talking about discovery science and the fruits of the early stages of that journey. There is the more important part, which is manufacturing, getting the product into the clinic, and more importantly for agriculture, for food security, getting the food into the people's tables. And I just want, if possible, Dinaka, to just share with us at least the journey from the time when that discovery journey is done and to a point where we actually have a product. Because a patent is not a product, it's a legal instrument. So we're more interested in getting the medicines.
I think it's a very important point. As was illustrated in case of one example by Steve, that scientists, what they do in the lab is to develop, essentially make a discovery. And that discovery may or may not have any value in terms of intellectual property. That needs to be assessed, and patent has to be protected, but it has to be protected through a patent. But what is most important is what you do next. And ICGB has been quite active in terms of patenting most of the technologies that are being developed, and subsequently try and search for partners in terms of what we do next. Because most academic institutions, something similar to ICGB, they don't have such a substantial internal infrastructure to go into the developmental stages beyond a certain step where you can demonstrate to industry that this is viable to be taken forward. And once we take a partner, we actually work out to transfer the technology to a partner so that they can carry forward, and then subsequent steps follow. and we are with the industry partner at each of the stages. So most important step after actually obtaining patent is to make the technology that has been developed is appropriate for industry partner to understand and appreciate that it has a value in the market, and that process of evaluating that is done jointly by our research team and the industry partner. And quite a few technologies in diagnostics or in vaccine development we have worked upon. That is the process we have adopted. We have a technology for even biofuel generation. We have reached a stage even of actually scaling up to an extent that industry wanted us to demonstrate, and then we actually are looking for an industry partner. So by interaction with the industry, we try to bring the technology to a stage where it is convincing for the industry to take it up, and then work in partnership with the industry to follow up the subsequent steps. Thank you.
Dr. Sibanda, good thing is that I now reveal that you're not just a liar, you're also an engineer by training. Before you switched on to the dark side, you were an engineer, so you know a thing or two about manufacturing. How do you see inbound technology, which you mentioned in your opening remarks, contributing to building capacity and ensuring food security and universal access to health?
Yeah, so thank you very much for the question. So earlier on, I spoke about the investment in R&D, and then that then translating into patent outputs. It takes time to build R&D capacity. And we've seen it in South Africa. I think the government started a concerted effort in investing in biotech in 2000 or so, with the likes of LifeLab that you led and other organizations. And we're only starting to see the fruits of that now, which is almost over 20 years down the line in terms of patent outputs. So, but what one can do is start to identify what I call pockets of excellence and specific areas of focus within the country. And in those particular areas, then identify partners outside of South Africa or Kenya or Malawi or whichever country, people that have got capability. And I think a case in point is a few years ago, 2006 or so, LifeLab and Bioped led a particular concerted effort to get technology, from Emory to be licensed into South Africa to then provide, a base for what was called Itemba Pharmaceuticals to then start to build up on. So inbound technology transfer is quite critical, and inbound relies in essence on two things. One is that there has to be some absorptive capacity in the country to receive that particular technology, and where there is no absorptive capacity, then part of the inbound technology transfer has got to come in with either the capacity coming in from the recipient, or some effort to take some skills or some people here and send them to the particular country or company that's providing that inbound. So that is one part. The other part in respect of inbound technology transfer is also relying on things like licensing of particular patents, and this assumes that there is actually patent protection, in the country, and where the IP is largely on know-how, then the inbound is actually transfer of know-how, and I think we've seen that in South Africa with the diagnostics, platform that was being also transferred, from India, at a particular point in time, into a company in South Africa.
Thank you, McLean. I think both McLean and Tinaka have touched on something that I want to explore with Stephen. Emory, or one of Emory's platforms, has recently concluded a deal to license, I think it was the first oral pill for COVID, Molnupiravir, to Merck, but that license also had something attached to it, designed in a way that would enable the distribution of this pill to the rest of the world through a sub-license to an Indian company, manufacturer. And I think that is something that we want to explore to see whether there is a possibility to link the outputs of innovations that provide life-saving drugs and maybe even foods in other instances, and in essence have a win-win situation where the commercial objectives are achieved with a license to a company, let's say in the global north, and a company in the global south that will achieve. And it's certainly one of the fundamental principles of the transaction that we were discussing 20 years ago with Emory around antiretrovirals. If you could just maybe.
Sure. Can you hear? Yeah, okay. So he's referring to a drug that was first invented at Emory. At the time it was EIDD 2801. It's now Molnupiravir, which is one of the 2 orally available COVID therapies. And it was the first one in the pipeline. It's since been overtaken by the other in terms of efficacy, or at least proven efficacy. If I could just give you a brief history of that to give you a sense. So we had a successful royalty event with Emtreva, an HIV drug, and one of our faculty members had control of some of that money and reinvested it in something called DRIVE, which was a wholly controlled drug development company, a nonprofit drug development company, because we believe in this challenge that universities have of getting into the development phase, not just the discovery phase. If you've heard of the expression, the valley of death, where the lack of funding, well, we would joke that DRIVE lives in the valley of death. And that's where we put some money, and it was a long, hard road, but there was a molecule they were pursuing, but not for COVID. It was for other indications. It was for influenza, Venezuelan equine encephalitis. But it happened in 2019 to be tested for activity against coronavirus, generally. And it was found to be active against coronavirus, which in 2019, when published, not many people cared. Shortly after that, people cared very much. And we licensed it to a small company, Ridgeback, which quickly did a phase 1 clinical trial. And this is evidence. We own the patent. We couldn't do a clinical trial. Without partnering with someone who brought private capital, it wouldn't have gone anywhere. They were able to do it quickly. They in turn did a joint development agreement with Merck. So Merck's developing the drug. And this will sound like a pitch, but it is, despite being a lawyer, it's the truth. Merck was very eager and very insistent on doing 2 things to promote access to the drug. One was a sublicenses to 8 different Indian manufacturers, and Emory waived any royalty we had on that during the term of the pandemic. And then also issued a license to the Medicines Patent Pool, which was something I'd heard about but didn't really understand. And if you don't know how it works, I'd like to explain it because it is really very interesting. So the Medicines Patent Pool licenses the technology from Merck, and then sub-licenses to, I think, so far a dozen generic manufacturers. And again, we waived all royalties for sale in 105 the least developed countries and middle developed countries. There is an aspect of the South African relationship that made people unhappy because it was really only a relationship for sales with public the public purchasers, not private purchasers. But as a general matter, it provided access to the technology, the rights to develop the technology to generic manufacturers. And the strategy was very, I think was very clear, was the more generics this is manufactured to, it drives the price down and discourages unauthorized manufacturers. Right? I mean, so it is it's a shrewd business decision on the multinational. It also allows for other access, and in theory at least, should drive the price down. I don't know enough to know how it's actually impacted, but I did look it up this morning, and I don't believe that there's a South African generic that is signed on to the medicines patent pool. I know there was discussion about it, but it didn't happen. The last thing I would add, from the perspective of someone like Emory, the more manufacturers outside the United States, and then the more development opportunities outside the United States, that's in our, let's say, business interest. We're very eager to have more potential partners who are also interested in developing the drugs for those conditions that may not be of interest to the larger companies. So it's something that we would see as a business opportunity if that were to happen more.
Thank you. There you go. To challenge you, the audience, to start asking questions. I see one hand here. There's a lot of hands, so I'm gonna let the guys walk around with the roving microphone. But the first person I saw, not the first person who raised their hand, was Judy. And I think I see Robert there. Other people will have to forgive me if I don't mention them by name. But the roving microphone.
Thanks, Nklanhla. So my question's to McLean, and I am focusing because I see your book on the side of you. So you mentioned about the importance of R&D. From your manuscript, what would you say one of the key strategies are to really enable IP and innovation in Africa? Sorry, it's a big one, but I'm sure you can pull it there. Thanks.
If one looks at let's say the US or Europe, or even the East, most of the R&D is funded by the private sector. And we've seen even the classical case of South Korea. In the early days, most of the funding came from the state, but over a period of time, then private sector starts to provide more funding. When you look in the continent, South Africa in particular, I think over 52% of the funding for R&D is provided by the state, and that's followed by the private sector. When one goes outside of South Africa into Uganda, Kenya, Tanzania, it's quite interesting because although the state is somehow providing funding, the extent of funding is quite minimal. A huge amount of funding, particularly in the healthcare or biotech sector, is actually donor funding, from the likes of, Gates Foundation and other entities. And obviously, the focus is what the funders are interested in. And in some of those funding contracts, there are restrictions in respect of ownership of IP and who actually commercializes, IP. And so I would say that, the one thing that we need to do more of in the continent is to increase the budgets, for R&D, for the government to do that. And as we, and again, it's got to be in focused areas. You can't just fund everything. I think you have to take an approach and say, in 20 years' time, or first of all, what are the disease burdens that we face today? What are the disease burdens that we're going to face in the future? And therefore, what kind of capabilities do we need to build so that we're actually self-sufficient into the future, and basis that, where do we then invest our own money, and where do we then utilize inbound technology transfer to build up, capability, and what kind of industries do we want to build in, and how do we incentivize, for example, more startups and more private sector to be involved, so that over a period of time, we then start to transform the ecosystem and have more private sector funding, R&D. And I think it's no surprise that there's low funding by private sector in most of the continent, because you take, I think you work for Amgen or Pfizer. Most of the operations of these companies in the continent are sales offices. There's very little research, and therefore it's quite important for African governments to start to then focus on endogenous kind of private sector entities. And I think you look at South Africa. I think companies like Aspen should be actually providing more funding, because I would argue and say that they've benefited in essence from being located here and having access to certain capabilities of other companies. Thank you.
Thank you, McLean. Robert?
Thank you so much. My name is Robert, and I think two quick questions. I think the first one is going back to the Emory drug, and is it a small compound or is it a biological? And the reason I'm asking is partly because the pathway is very much what we've seen with HIV and a lot of drugs and health technologies. It goes to India, and then India kind of serves the world, and more specifically serves Africa. And the challenge sometimes I keep asking is, how do we get the tech transfer to actually happen also to Africa directly? We've been doing a lot of thinking and trying to understand, and I think COVID, of course, was a big lesson in terms of the need for actually having local manufacturing, local production. And the challenge that I keep seeing is we are caught in a catch-22. We can invest, but we have a very skewed market because we get out of donor funding coming to our health systems. And to break out of that, we need to find a way of being part of that global procurement system of the global funds and what have you, but we don't have a way in. How do you overcome some of this? Yeah.
I certainly don't have the answer to how in, but I can add a couple things. It's a small molecule. Part of the logic behind the medicine's patent pool is to try to incentivize manufacturing, not just in India, to be honest, right? Because you have the capabilities in India, but that doesn't make sense. You want to have it more. With the Emory people that I've been working with for years, with Dr. Msomi, and been talking about the need for manufacturing capability here. When you talk about tech transfer is going to happen most efficiently and effectively when there's a product that the technology needs to be transferred to do. So we need to have, couldn't agree more, and that I would say that there's research, development, manufacturing, and these aren't, yes, there's some distinction between, but it's a spectrum, right? And so the research and the discovery phase, which we spoke to earlier, but both development and manufacturing do require some incentive. And from where I sit, it's hard to see without some sort of significant philanthropic or government support, because there's too many market entrants in the manufacturing outside the continent. It's going to be very hard to break into that at this point, would be an observation about that.
There was a hand here, this side, yeah, McLean. Before Sbar.
Thank you. My name is Joshua. I am a founder of a tech startup. And so my question is mostly related to software. Allow me to ask 3 questions. And to the lawyers, mostly McLean, because you're Is that okay?
The lawyers are instructed to only answer one question. There's another hand for my brother-in-law here, and my sister will disown me.
I'm going to ask on behalf of all the founders in Africa. So, first is, can you patent software? That's one question. And if you're going to patent it, question 2 was, should you patent the software in Africa, or should you patent the software in other countries outside of Africa? The other question I have is, one time, well, since the software patenting or the tech patenting process is that you disclose what you're doing, how then can you protect yourself from infringement from much larger players if you're in Africa? And so let's say, for example, you patent here and you're developing your product here and you're marketing it here in Africa and for a local solution, and then it's infringed by somebody in China or in Europe or in the US, and you're here, you don't have the money. How are you going to protect yourself? Does it make sense to patent? And at what point should you patent your software and disclose it to the world? And then how do you then protect yourself from infringement? Thank you.
On the first part of your question, can you patent software? Generally what you find is most patent laws say that computer programs per se cannot be patented. And we've seen trends throughout the world that if a particular software causes a technical effect, you can patent it. But there has to be a technical effect. So if, for example, the software then, there's a garage and it allows the garage to open, and if there's an object that it senses, then it stops, you can patent that because there's a technical effect, that is inherent. But in the case where there's no technical effect, you cannot patent a computer program or software because there's an assumption that that would be protected by way of copyright. So the source code is protected by copyright. Now let's take the case where then it's protectable because it causes a technical effect. The decision as to where to protect and where not to protect is really a market decision. You protect in the big markets where you're likely to, the product is going to be sold, or that's where you're going to be manufacturing. So that's how you'd go, about it. I mean, Steve will answer more from the US, point of view. I think on your second question regarding infringement, it goes back to the concept of territoriality. So if you've not protected in China, they won't be infringing your patent; they'll just be copying. Because you've protected in South Africa, you've protected in the US. But you've left out China, so therefore in China they can copy, and it's allowed. That's the whole concept of territoriality. So you choose the countries where it makes sense. So your market, your big markets and so forth, that's how perhaps you'd go about it. But obviously the struggle is which markets, and it's very costly, and therefore you take a gamble and say, well, these are the big markets that we're looking at, and therefore this is a budget that we're going to need to spend over X period of time, and therefore we're going for these countries. In the rest, if they copy us, that's how the system works.
At the risk of sounding rude, I do not want this to descend into a legal counseling consultation session. I'm going to request Dennis and Wendy after Dennis, and the gentleman here to ask their questions one after the other, and then the panelists can answer them.
Okay. Thank you very much. Now, the issue of patenting is important for the reasons that you have mentioned in your various presentations. However, I believe that in Africa there are very many SMEs who still do not appreciate the importance of patenting. So you have SMEs, not necessarily in the medical field, even in other spheres, we have come up with very innovative products, but have not patented them, and they end up getting patented elsewhere. I'm aware that India, many SMEs in India, for instance, have managed to go the patent route. And my question, therefore, is that are there any lessons that regions like Africa could benefit from, the Indian experience? Is there, for instance, a structured way of giving information to SMEs so that they know the importance of patenting? Some just come up with innovative products and then, they're excited, voila, that's a great thing and it's in market, but then they don't get to the point where they patent it. So I guess I'll throw my question first of all to Dinika to see whether there are any lessons that we could learn from India, where a lot of the SMEs have known the importance of patenting and actually go that route. Because
Thank you. Thank you. Wendy, you should ask a question so that the panelists can answer them one after the other. Oh, sorry, you're running away. No, I was asking Wendy if Wendy can ask. And then the gentleman over here.
to buy
Give Wendy the mic. And then pass it on to the gentleman over there.
So thank you. Hopefully you forgive me for not standing up. I will be the first to admit I am not so well versed in patent law, but I've become aware recently of the various efforts at the international level in terms of access and benefit sharing, especially when it has a purview over genetic resources, not just genetic, but also proteomic and metabolomic sequences. And I'm just asking you, more the experts, what adjustments or modifications are you making to your procedures of ownership as to who has the right to patent these sequences? Is it the researcher who discovers the functionality that would be derived from these sequences, or to what extent do the nationalities, the government mechanisms have a right to ownership of these sequences such that you have to take them on board when you register them in a patent environment? And if you can bring us up to speed on how those negotiations are occurring and what adjustments that you have to make, that would be really welcome to a poor research scientist such as myself.
Thank you, Mr. Chair. Through you, my name is Rian de Preer, and I'm from a company called AfriVet Animal Health, and we're one of those small commercial companies that dearly want to take IP and innovation to the commercial level. But in this thread, I miss the final step of the regulatory process. And my question is there alliance, and maybe McLean is to you, knowing the South African context perhaps better, but advice from you and how it works in America. It's good to find an innovation that's patented and now you want to commercialize it, but then you wait 8 to 14 years for the regulatory process to get a registration of these fantastic innovations that would bring food to the table of the people, that would stop disease. And this is probably not the platform, but does the Department of Innovation and Science, are they in alliance, or the other way around, is the Department of Agriculture and Department of Health with Act 101 and Act 36 that has to register these things, are they in tandem with these innovations to bring them to market as quickly as possible? Because that's not what we are experiencing.
Thank you. I'm going to request the panelists to answer as per the questions, starting with Dinaka, because I think Dennis's question was directed more towards you and McLean, and then Stephen to close off. Just by the way, in case you are watching the gestures of this gentleman, I don't work for the government departments that he was talking about. I just happen to be in his line of gesturing, you know. So, please don't conclude anything by it. And once we've heard our response from the panelists, we would like to conclude today's session because I know that we are the thing that stands between you and some food and party. So I would like to request Tinaka to respond.
I'll first respond to Wendy and then to Dennis. Your question was whether the discovery, whether it is identifying a gene by a discoverer, the ownership comes to whom? I think the rules with regard to that are different in different countries. In India, the technology that is developed is owned by the institution with which the scientist is formally associated, and benefits of that discovery can actually go to the discoverer, but the ownership actually stays with the institution with some understanding with the funder, and that is very clearly defined in Indian context. With regard to SMEs, how do they protect what they do? In India, a lot of it is very chaotic, but one of the formalized way of getting protection of intellectual property is being done in India, where many of these are organized into smaller clusters, and there are patent offices being established. Say in case of biotechnology, Department of Biotechnology has actually worked out setups in many of their institutions to facilitate the developed technologies for that particular region. So there are initiatives now to help small discoverers and technology developers to actually get protection for their technologies. Thank you.
Let me start with the last question. I think in terms of regulatory approvals, I think it's getting better. From a health point of view, we've seen the establishment of SAPRA. And if we just reflect in terms of the last 2 years during the pandemic, the approvals have been quite quick and they've been quite responsive. But also I think from a leadership point of view, it's people that have come through the entire R&D process. I mean, Dr. Semete has been a researcher and has been part of the DSI and so forth. So I think there's a recognition that the approvals need to actually happen much more quicker, so that people can then get through to the market. Naturally, there's then other things like the BOLA provisions in the case of health that then would allow people that want to enter to then take advantage of that. And I think the other question in terms of benefit sharing, I think what we've seen in South Africa is that the Patents Act has been amended to allow for the ownership resides with the party that comes up with the invention, and in the case of a researcher working at a university or funded by the state, then the recipient of that funding then owns it. But then from a commercialization point of view, there has to be benefits that then flow back to the communities per se. And so in those particular instances, it's very important to then start the process of negotiating access and having the agreements access agreements right from the front, right from the beginning, so that when you get to the point of patenting, you can then have all that in place, because there's a requirement in terms of granting of a patent in South Africa that you must have reached an agreement in respect of access to the indigenous knowledge or genetic material, and that there must have been some benefit sharing arrangement that would have been arrived at.
The last point goes to Stephen.
So I'll make a pitch here. Because those questions were way too hard for me to try to answer specifically. So as a lawyer who's worked for years and years and years with scientists, I'm very used to them who are every scientist is very, very smart. When it comes to the regulatory pathway or patenting, they kind of think, how hard can this be? Right? I mean, this should be, these things should just be able to happen. I want to go back to the concept of development. We've got research and development. Companies, Bell Labs from the United States, research and development and manufacturing and sales is one long string, right? That's not the way it happens in life sciences anymore. And I want to make a plug for BioAfrica in the third, fourth, and life sciences innovation. Innovation is another word in our book for development. You've got brilliant people coming up with ideas. You've got lots of people who will sell a finished product. Innovation is very, very hard, and it requires a concerted effort that's multidisciplinary, and we would say now is multi-continental, if that's a word, because you can't do it in just one continent. And so I really want to, just applaud and thank you for including us in this, because life sciences innovation is critically important, and it's very, very difficult.
Thank you, Stephen. I think you might have stolen my closing words. I don't know where you saw them, maybe when we were having breakfast. Thank you, everybody, for being such a good audience. We have 3 more days of the convention, but I would be remiss if I did not correct something that Dr. Sibanda said. Science globally, empirically, all evidence suggests that it's funded by the public purse. And that the reality is that countries that are advanced is because their governments take a strong stance that they are going to fund discovery science, because it's the only way that you get to move up the ranks. And that's the fundamental. The private sector may contribute to innovation, as Stephen has pointed out, innovation which is much closer to products, but not science. Even discovery science is a government responsibility. And I think part of what we need to do, particularly in this continent, is to lobby, advocate for increased funding of discovery science, and come to a partnership with our governments around innovation. Because government, it's not the government's responsibility to fund innovation and to become private parties. It's our responsibility as companies, as entrepreneurs, to do that. And I think that's something that hopefully we will probe during the convention, and the panelists that are here are around to either engage with you or continue to mislead you during the day tonight. Thank you.
Thank you.